welcome back to this peaceful space. Let's begin with a gentle breath together. Breathe in slowly through your nose and release softly through your mouth. Today we're going to explore something that can feel overwhelming in the skincare world. How to choose a moisturizer that's truly right for your unique skin. Walk into any store or browse online and you'll find hundreds, perhaps thousands of moisturizers. Creams, lotions, gels, balms, serums, lightweight, medium weight, rich, ultra rich, for oily skin, for dry skin, for combination skin, anti-aging, pore refining, brightening, soothing. The options are endless, and the marketing promises can be dizzying. How do you possibly choose? The truth is simpler than the beauty industry would like you to believe. Choosing a suitable moisturizer doesn't require a chemistry degree or an unlimited budget. It requires understanding three things: what moisturizers actually do, what your skin actually needs, and how to listen to the signals your skin sends you. Let's start with the basics. What is a moisturizer, really? At its core, a moisturizer is a product that helps your skin retain water. That's it. Everything else, the textures, the additional ingredients, the fancy packaging, is secondary to this primary function. Your skin needs water to function properly, to look healthy, to feel comfortable. A moisturizer helps keep that water where it belongs, in your skin. There are three main ways moisturizers work, and understanding these will help you choose wisely. First, there are humectants. These are ingredients that attract water from the environment or from deeper layers of your skin and bring it to the surface. Think of them as magnets for moisture. Common humectants include hyaluronic acid, glycerin, and aloe vera. Second, there are emollients. These are ingredients that fill in the tiny gaps between skin cells, smoothing and softening the surface. They make your skin feel silky and comfortable. Common emollients include plant oils, shea butter, and ceramides. Third, there are occlusives. These create a physical barrier on your skin's surface that prevents water from evaporating. They seal everything in. Common occlusives include petrolatum, dimethicone, and certain waxes. Most good moisturizers contain a combination of all three types of ingredients. The proportion of each determines the texture and weight of the moisturizer. A lightweight gel might be mostly humectants. A rich cream might have more emollients and occlusives. Understanding this helps you decode product descriptions and choose what your skin needs. Now let's talk about your skin. What type do you have? This is the question everyone asks, but here's a secret. Your skin type isn't as fixed as you might think. It can change with seasons, with age, with stress levels, with hormones, with climate. You might be oily in summer and dry in winter. You might be combination now but become drier as you age. So instead of rigidly categorizing yourself, learn to observe your skin day by day. Generally speaking, if your skin feels tight, flaky, or uncomfortable without moisturizer, you have dry skin. If your skin looks shiny and feels greasy, especially in your T-zone, you have oily skin. If you're shiny in some areas and dry in others, you have combination skin. If your skin reacts easily to products with redness or irritation, you have sensitive skin. And here's an important note. You can be oily and dehydrated at the same time. Oiliness refers to sebum production. Dehydration refers to water content. They're different things. For dry skin, you'll generally want a richer moisturizer with plenty of emollients and occlusives. Look for creams rather than lotions or gels. Ingredients like shea butter, ceramides, squalane, and fatty acids will be your friends. Your moisturizer should feel nourishing and should leave your skin feeling soft and comfortable for hours. For oily skin, you'll generally want a lighter moisturizer that hydrates without adding heaviness. Look for gel creams or lightweight lotions. Ingredients like hyaluronic acid, niacinamide, and light plant extracts work well. Your moisturizer should absorb quickly and shouldn't leave your skin looking greasy or shiny. Remember, even oily skin needs moisture. Skipping moisturizer can actually make your skin produce more oil to compensate. For combination skin, you have two options. You can use one medium-weight moisturizer all over, or you can use different products on different areas. A lighter gel on your oily T-zone and a richer cream on your dry cheeks, for example. There's no wrong approach. Do what feels right and works for your lifestyle. For sensitive skin, simplicity is key. Look for fragrance-free, hypoallergenic formulas with minimal ingredients. Avoid anything with essential oils, harsh preservatives, or irritating actives. Ingredients like colloidal oatmeal, Centella asiatica, and allantoin are often well tolerated and soothing. But beyond skin type, consider your climate and environment. Do you live somewhere humid or dry? Are you in air conditioning all day? Do you work outdoors? These factors affect how much moisture your skin loses throughout the day. In dry climates or heated indoor environments, you might need a richer moisturizer even if you typically have oily skin. In humid climates, even dry-skinned people might prefer something lighter. Consider the time of day too. Many people use different moisturizers in the morning versus evening. Morning moisturizers are often lighter because they need to sit well under sunscreen and makeup. Evening moisturizers can be richer because you have all night for them to absorb and work. This is perfectly fine. Your skin's needs aren't identical at all times. Now let's talk about additional ingredients and claims. Anti-aging, brightening, pore refining. These are bonuses, not necessities. A moisturizer's primary job is to hydrate. If it also contains ingredients like retinol, vitamin C, or niacinamide that address other concerns, that's wonderful. But don't choose a moisturizer based solely on these additions if the base formula doesn't suit your skin. Some ingredients to appreciate. Ceramides help restore and maintain your skin barrier. Niacinamide helps with oil control, pore appearance, and redness. Hyaluronic acid provides intense hydration. Peptides may support collagen production. Antioxidants like vitamin E help protect against environmental damage. If these ingredients appear in your moisturizer and your skin tolerates them well, enjoy the benefits. But they're not required for a good moisturizer. What about price? Here's an honest truth. Expensive doesn't always mean better. Some of the most effective, gentle moisturizers are relatively affordable. Some luxury moisturizers are lovely, but don't perform better than their budget counterparts. The fancy jar, the prestigious brand name, the exotic ingredients, these don't necessarily translate to better hydration. Focus on what's inside and how your skin responds, not the price tag. How do you test if a moisturizer is right for you? First, patch test. Apply a small amount to your inner forearm or behind your ear for a few days. If no irritation occurs, try it on your face. Use it consistently for at least 2 weeks before making a final judgment. Skin needs time to adjust to new products. Pay attention to how your skin feels immediately after application. Does the moisturizer absorb well, or does it sit on your skin's surface? Does it feel comfortable? Script, Jabber 77. The truth about pore size, what you can and cannot change. Soft calming tone throughout, approximately 1,700 words. Hello and welcome. Take a deep breath in, hold it gently, and release. Today we're going to explore one of skincare's most misunderstood topics, pore size. We'll separate fact from fiction and understand what's actually possible when it comes to the appearance of your pores. First, let's establish an important truth. You cannot permanently shrink or close your pores. Your pore size is primarily determined by genetics. This might feel disappointing, but understanding this reality frees you from chasing impossible promises and helps you focus on what actually works. Let's explore pores with calm, informed awareness. What are pores actually? Pores are tiny openings in your skin that serve essential functions. Each pore is a hair follicle opening, and attached to each is a sebaceous gland that produces oil, sebum. This oil travels up through the pore to moisturize and protect your skin's surface. Pores are not muscles. They don't open and close like doors or windows. The opening you see is a fixed structure determined by your genetic blueprint, skin thickness, and oil production levels. What determines pore size? Your baseline pore size is primarily genetic. If your parents have larger pores, you likely inherited that tendency. This is not something you did wrong or could have prevented. It's simply your skin's architecture. However, while genetics determines your baseline, several factors can make pores appear larger. Oil production. The more oil your skin produces, the more pronounced your pores typically look. Oily skin almost always has more visible pores than dry skin. Age and sun damage. Collagen and elastin keep skin firm and pores less noticeable. As these proteins break down with age and sun damage, skin loses firmness and pores can appear larger. Think of it like a stretched fabric. The holes become more visible as the fabric loses its tightness. Congestion. When pores fill with oil, dead skin cells, and debris, they stretch. A stretched pore appears larger. This is the most addressable factor. Clearing congestion allows pores to return to their natural size. Inflammation and skin condition. Chronic inflammation can make pores appear more prominent. Conditions like rosacea or ongoing irritation can affect pore appearance. Dehydration. When skin is dehydrated, it can appear rough and textured, making pores more noticeable even if they haven't actually changed size. Now let's discuss what you actually can do to improve pore appearance. Keep pores clear. This is the single most effective approach. Clean pores appear smaller, congested pores appear larger. Regular cleansing removes surface oil and debris before it accumulates. Double cleansing. Oil cleanser followed by water-based cleanser is particularly effective for oily or congested skin, ensuring thorough removal of sunscreen, makeup, and excess oil. Chemical exfoliation with BHAs, particularly salicylic acid, penetrates into pores, dissolving oil and debris from within. This is more effective for pore clearing than physical exfoliation, which only addresses the surface. Use BHA 2 to 3 times weekly or daily if your skin tolerates it well. Be consistent. Pores refill with oil and dead skin cells constantly, so regular exfoliation maintains clarity. Clay masks draw out impurities and absorb excess oil. Use once or twice weekly on areas with enlarged pores. Let the mask dry, but don't leave it on so long that skin feels tight and uncomfortable. Support collagen and skin firmness. While you can't reverse decades of collagen loss overnight, supporting your skin's structural integrity helps minimize pore appearance. Retinoids stimulate collagen production and improve skin thickness over time. With months of consistent use, skin becomes firmer, and pores may appear less noticeable. Vitamin C is an antioxidant that supports collagen synthesis and protects existing collagen from damage. Peptides in skincare signal skin to produce more collagen and maintain firmness. Most importantly, sun protection. Sun damage is one of the primary causes of collagen breakdown. Daily broad-spectrum SPF 30+ prevents further damage that would make pores more apparent. Optimize hydration. Well-hydrated, plump skin has a smoother appearance where pores are less noticeable. Hyaluronic acid serums attract and hold moisture, plumping skin from within. Niacinamide improves skin barrier function, helping it maintain moisture better. Adequate water intake supports skin hydration from the inside. While drinking water alone won't shrink pores, chronic dehydration can make skin appear rougher and more textured. Control oil production. Excess oil makes pores more visible. Managing oil production can help. Niacinamide is proven to reduce sebum production when used consistently. BHA exfoliants keep pores clear and can help regulate oil over time. Lightweight, non-comedogenic moisturizers hydrate without adding heaviness that makes oily skin worse. Interestingly, over-cleansing or using harsh, stripping products can increase oil production as your skin overcompensates. Gentle but thorough cleansing is more effective than aggressive cleansing. What about professional treatments? Some professional treatments can improve pore appearance more dramatically than at-home care. Chemical peels. Professional strength peels exfoliate more deeply, clearing congestion and stimulating collagen production. Results are temporary but can be significant with a series of treatments. Microneedling creates controlled microinjuries that stimulate collagen production. Over multiple sessions, this can improve skin texture and firmness, making pores less apparent. Laser treatments. Certain lasers, like fractionated CO2 or Fraxel, stimulate deep collagen remodeling. These are expensive and require downtime but can provide noticeable, longer-lasting improvement in pore appearance. Professional extractions. Done correctly by trained estheticians, extractions clear congested pores more thoroughly than at-home care. This provides immediate improvement in appearance. However, even these treatments don't permanently shrink pores. They improve appearance temporarily or require maintenance to sustain results. Let's discuss what doesn't work, despite popular claims. Icing. While icing temporarily tightens skin and may make pores less visible for a short time, this effect lasts only minutes. Ice cannot permanently affect pore size. Pore shrinking products. Products claiming to shrink or close pores are misleading. They might tighten skin temporarily or clear congestion, which helps, but they're not actually changing pore structure. Look past marketing to understand actual benefits. Steam, opening pores. Steam softens the plugs in congested pores, making extraction easier, but it doesn't open pores. Similarly, cold water doesn't close them. Pores are not doors. Egg whites, lemon juice, and DIY remedies. These home remedies are at best ineffective and at worst harmful, particularly lemon juice, which can burn and sensitize skin. They don't shrink pores. Harsh scrubs. Aggressive physical exfoliation doesn't clean pores deeply and can irritate skin, potentially making everything worse. Gentle chemical exfoliation is far more effective. Now let's talk about perspective and expectations. Visible pores are completely normal. Look closely at anyone's skin. Everyone has pores. Magazine photos are heavily edited. Welcome to this calm, focused space. Breathe deeply and settle in. Today we're clarifying the difference between serums and creams, two essential categories of skincare products that serve different but complementary purposes. Walk into any beauty store and you'll see shelves filled with serums, creams, lotions, and gels. The variety can feel overwhelming. Understanding what makes each type of product unique helps you choose what your skin actually needs rather than buying products based on marketing alone. Let's start with serums. Serums are lightweight, concentrated formulations designed to deliver high concentrations of active ingredients deep into your skin. They have smaller molecules than creams, which allows them to penetrate more effectively. Serums are typically water-based or gel-based, though some are oil-based. They feel light on your skin. They absorb quickly and don't leave a heavy residue. The key characteristic of serums is concentration. Because they're not diluted with heavy moisturizing agents, serums can pack powerful ingredients into small amounts of product. A few drops of serum might contain more vitamin C, retinol, or hyaluronic acid than an entire jar of cream. Serums target specific concerns. You might use a vitamin C serum for brightening and antioxidant protection, a hyaluronic acid serum for intense hydration, a retinol serum for anti-aging and texture improvement, a niacinamide serum for oil control and pore appearance. Each serum is formulated with a particular goal in mind. Because serums are concentrated, they're typically more expensive ounce for ounce than creams, but you use much less product per application, usually just 3 to 5 drops for your entire face, so they last longer than you might expect. Now let's understand creams, which include moisturizers, lotions, and face creams. Creams are emulsions of water and oils, designed primarily to moisturize your skin and seal in hydration. They create a protective barrier on your skin's surface that prevents water loss. Creams contain humectants that attract water, emollients that smooth and soften, and occlusives that seal everything in. Creams are typically thicker and richer than serums. They take longer to absorb because they're meant to sit on your skin's surface as a protective layer. This is exactly what you want in a moisturizer. You don't want all that hydration to penetrate deeply and then evaporate away. You want it sealed on and in your skin. Creams can also contain active ingredients, but usually in lower concentrations than serums. A cream might have some niacinamide or peptides included, but the primary purpose is moisture and protection, not intensive treatment. The texture of creams varies widely. Lightweight lotions for oily skin, rich creams for dry skin, gel creams for combination skin, but all serve the same fundamental purpose: moisturizing and protecting. So here's the essential difference. Serums treat specific concerns with concentrated active ingredients. Creams hydrate, protect, and seal in all the good stuff your serums delivered. This is why many skincare routines include both. The serum provides treatment. The cream provides moisture and protection. Together, they work synergistically to address your skin's needs comprehensively. Let's walk through how to use serums and creams together in your routine. After cleansing and toning, if you use a toner, Apply your serum first. Pour a few drops into your palm. You really don't need much. Warm it between your hands briefly, then press it gently into your face and neck. Use patting and pressing motions rather than rubbing. Take your time. Let the serum absorb for 30 seconds to a minute. If you're using multiple serums, apply them from thinnest to thickest consistency. Water-based serums go first, then gel serums, then any oil-based serums. Wait a moment between each one to allow proper absorption. After your serum has absorbed, apply your cream or moisturizer. Take a pea-sized to dime-sized amount, more for dry skin, less for oily skin. Warm it between your hands, then apply it all over your face and neck, using gentle upward strokes. The cream seals in your serum and provides additional hydration and protection. In the morning, follow your moisturizer with sunscreen as the final step. At night, your moisturizer is typically your final step, unless you're using an overnight treatment or sleeping mask. This layering order, thinnest to thickest, treatment to moisture to protection, ensures each product can work effectively without being blocked by heavier products applied before it. Now let's address some common questions about serums and creams. Do I need both a serum and a moisturizer? If you have specific skin concerns you want to address, aging, dark spots, acne, dullness, a targeted serum can be very helpful. Combine it with a moisturizer appropriate for your skin type, and you have a complete routine. However, if your skin is generally healthy and you just want to maintain it, a good moisturizer alone might suffice. There's no absolute rule. Listen to your skin and your goals. Can a serum replace my moisturizer? Usually no. Most serums don't contain enough occlusive ingredients to prevent water loss. If you use a hydrating serum like hyaluronic acid without sealing it in with moisturizer, the water it attracts will simply evaporate away, potentially leaving your skin more dehydrated than before. There are a few exceptions. Some very rich oil serums might provide enough occlusion, but generally, you need both the treatment of a serum and the protection of a moisturizer. Can I mix my serum with my moisturizer? You can, and some people prefer this for simplicity or because they find it helps with application. However, you might reduce the effectiveness of your serum slightly by diluting it. If you're going to mix them, apply your serum first, let it absorb partially, then apply moisturizer on top. This is better than mixing them in your hand before applying. How do I choose which serum to use? Identify your primary concern. Is it aging, dark spots, dehydration, acne, dullness? Choose a serum formulated to address that concern. Look at the active ingredients. They should appear high on the ingredient list to ensure adequate concentration. Start with one serum and assess how your skin responds before adding more. Having 5 different serums won't necessarily give you better results than one well-chosen serum used consistently. Can I use multiple serums? You can layer multiple serums if you have multiple concerns and your skin tolerates it well. However, more isn't always better. Sometimes using too many products overwhelms your skin or creates interactions between ingredients that reduce effectiveness. A good rule is to have 1 to 3 serums maximum, targeting your most important concerns. Should I use different serums morning and night? Many people do this strategically. Morning serums often focus on protection, vitamin C for antioxidant defense, hyaluronic acid for hydration. Evening serums often focus on repair, retinol for anti-aging and renewal, or treatments for specific concerns. This isn't required, but it can be an effective approach. Let's discuss specific situations and what combination of serum and cream works well. For dry, aging skin, use a hyaluronic acid serum for deep hydration, followed by a retinol serum at night for anti-aging benefits. Seal both with a rich, nourishing cream containing ceramides and peptides. In the morning, vitamin C serum under your moisturizer and sunscreen provides antioxidant protection. For oily, acne-prone skin, a niacinamide serum helps control oil and calm inflammation. A salicylic acid serum can target acne. Follow with a lightweight, oil-free gel cream that won't clog pores. You still need moisture. Oily skin needs hydration too. Welcome to this peaceful moment. Settle in and let's begin with a breath. Breathe in slowly through your nose. Hold for a moment and exhale completely through your mouth. Feel your body relax with that exhale. Today we're going to explore something remarkable, how something as simple as breathing can profoundly affect your skin's health and appearance. Breathing is something you do automatically, thousands of times each day, without thought. But when you bring conscious awareness to your breath, when you use it intentionally, it becomes a powerful tool for managing stress, supporting circulation, and promoting skin health. Let's start by understanding the connection between breath, your nervous system, and your skin. Your autonomic nervous system has two main branches: the sympathetic nervous system, which activates your stress response, and the parasympathetic nervous system, which promotes rest, relaxation, and healing. Your skin's health is significantly influenced by which system is dominant. When your sympathetic nervous system is activated, when you're stressed, your body produces cortisol and adrenaline. Blood flow is redirected away from your skin toward your muscles and vital organs. Your skin produces more oil. Inflammation increases. Healing slows. Your skin barrier weakens. We discussed these effects in our previous conversation about stress. When your parasympathetic nervous system is activated, when you're relaxed, opposite effects occur. Cortisol levels drop. Blood flow to your skin increases, bringing oxygen and nutrients while carrying away waste products. Inflammation decreases. Healing accelerates. Your skin barrier strengthens. Cell regeneration improves. Here's what's remarkable. Your breath is a bridge between your conscious and unconscious systems. While you can't directly tell your heart rate to slow or your blood pressure to drop, you can control your breath. And when you breathe slowly and deeply, your breath sends a signal to your nervous system. We're safe, we can relax. This activates your parasympathetic response. This isn't mystical or metaphorical, it's physiology. Slow, deep breathing stimulates the vagus nerve, the main nerve of your parasympathetic nervous system. This activation cascades throughout your body, including your skin. Let's explore specific breathing techniques that support relaxation and skin health. Diaphragmatic breathing, also called belly breathing, is foundational. Most people breathe shallowly into their chest, especially when stressed. This rapid, shallow breathing reinforces your stress response. Diaphragmatic breathing does the opposite. Place one hand on your chest and one on your belly. Breathe in slowly through your nose, allowing your belly to expand like a balloon. Your chest should move minimally. The movement should be in your abdomen. This is your diaphragm descending, allowing your lungs to fill fully. Then exhale slowly through your mouth, feeling your belly deflate. Practice this for a few minutes daily. Over time, this deeper breathing pattern can become more automatic. The 4-7-8 breathing technique is particularly effective for relaxation. Breathe in through your nose for a count of 4. Hold your breath for a count of 7. Exhale completely through your mouth for a count of 8, making a whooshing sound. Repeat this cycle 3 to 4 times. This pattern is deeply calming and can help quiet a racing mind or reduce anxiety. Box breathing, used by athletes and military personnel for stress management, is another powerful technique. Visualize a box as you breathe. Inhale for 4 counts. Hold for 4 counts. Exhale for 4 counts. Hold empty for 4 counts. Repeat several times. This creates a rhythm that calms your nervous system and helps you feel centered and grounded. Alternate nostril breathing from yoga traditions balances your nervous system. Use your thumb to close your right nostril and breathe in slowly through your left nostril. Close your left nostril with your ring finger. Release your thumb and exhale through your right nostril. Inhale through your right nostril. Close it and exhale through your left. This is 1 round. Continue for several rounds. Many people find this technique particularly soothing and centering. When should you practice these breathing techniques? Any time, but especially during stressful moments before sleep, upon waking, or during your skincare routine. Your morning and evening skincare rituals are perfect opportunities to incorporate conscious breathing. As you cleanse your face, breathe deeply. As you apply your products, maintain slow, relaxed breathing. This transforms your skincare routine from a task into a meditative practice that benefits both your mind and your skin. Now let's discuss the direct effects of proper breathing on your skin. Oxygen is essential for every cell in your body, including your skin cells. When you breathe deeply and fully, you increase the oxygen content of your blood. This oxygen-rich blood circulates to your skin, supporting cellular energy production, repair processes, and overall vitality. Skin that receives adequate oxygen has a healthy, vibrant appearance, that natural glow that can't be replicated by products alone. Improved circulation from relaxation and deep breathing means your skin receives more nutrients. Everything your skin needs to be healthy, vitamins, minerals, amino acids, antioxidants, reaches your skin cells via your bloodstream. Better circulation means better delivery of these essential nutrients. Waste removal improves as well. Your skin cells, like all cells, produce metabolic waste products. These need to be carried away for your skin to function optimally. Good circulation, supported by proper oxygenation and relaxation, enhances this detoxification process. Collagen production benefits from reduced stress and improved oxygenation. Collagen synthesis requires oxygen and numerous nutrients. When your cells are well oxygenated and your stress hormones are low, your skin can produce collagen more effectively. Your skin's barrier function strengthens when you're relaxed. Remember, chronic stress weakens your skin's protective barrier. Relaxation does the opposite, allowing your skin to maintain its integrity and protect itself from environmental stressors, irritants, and moisture loss. Inflammation reduces. This is perhaps one of the most significant benefits. Chronic low-level inflammation, often driven by stress, contributes to aging, acne, rosacea, and numerous other skin concerns. Practices that activate your relaxation response, including conscious breathing, reduce this inflammation. Let's talk about facial exercises and facial massage, both of which can be combined with breathing for enhanced benefits. Facial massage, when performed gently, can improve lymphatic drainage, reduce puffiness, and promote relaxation. As you apply your skincare products, take an extra 2 minutes to massage your face. Use gentle upward strokes. Work from the center of your face outward. Use light pressure. You're not pushing hard, just encouraging movement of fluids and gentle stimulation of your skin. As you massage, breathe deeply and slowly. With each exhale, release any tension you're holding in your face. Your face holds stress, just like your shoulders or back. Your jaw might be clenched. Your forehead might be furrowed. As you breathe and massage, invite these areas to soften and release. Gua sha and facial rolling tools can enhance facial massage. These tools, used gently with appropriate pressure, can feel wonderful and support lymphatic drainage. However, they're not necessary. Your fingers work beautifully too. What matters most is the gentle attention you're giving to your face, combined with relaxed breathing. Let's address progressive relaxation, a technique that can reduce overall tension and benefit your skin. Starting with your toes, tense each muscle group for a few seconds, then release completely. Move up through your body, feet, calves, thighs, abdomen, chest, hands, arms, shoulders, neck, face. Notice the difference between tension and relaxation. This practice helps you become aware of held tension and releases it, reducing the physical manifestations of stress on your skin. Mindfulness meditation, which often focuses on breath, provides significant skin benefits. When you practice observing your thoughts without judgment, when you return your attention to your breath again and again, you're training your nervous system to be less reactive to stress. Over time, regular meditation practice can reduce baseline stress and anxiety levels, which directly benefits your skin. You don't need hours for these practices. Even 5 minutes of conscious breathing daily makes a difference. The key is consistency. Daily practice, even if brief, creates cumulative benefits that occasional longer sessions cannot match. Make relaxation and breathing part of your overall skin health strategy. You invest time in choosing products, applying them carefully, protecting your skin from the sun. Invest a few minutes daily in breathing and relaxation too. This internal work supports and enhances all your external skincare efforts. Notice how your skin looks and feels when you're relaxed versus when you're stressed. Pay attention to this connection in your own body. You might notice that after a restful vacation, your skin looks radiant, or that during stressful work periods, your skin becomes problematic. These aren't coincidences. They're your body showing you the mind-skin connection. For those with specific skin conditions triggered or worsened by stress, breathing and relaxation practices can be particularly valuable. If you have stress-triggered acne, eczema flares, or rosacea outbreaks, incorporating daily relaxation practices might reduce the frequency and severity of these flares. One important note: learning to relax is a skill, especially if you've been chronically stressed for a long time. Your nervous system needs time to recalibrate. The benefits for your skin and your overall well-being accumulate over time, just like skincare products do. Don't expect instant perfection. Some days your mind will be too busy to quiet. Some days you'll forget to practice. This is normal and okay. What matters is gently returning to the practice again and again with patience and without judgment. As we come to the close of our time together, embrace this beautiful truth. You carry powerful skin treatments with you always in your breath and your capacity for relaxation. No product can replace the benefits of reduced stress, adequate oxygen, improved circulation, and your body's natural healing processes functioning optimally. Your skin is not just affected by what you put on it. It's profoundly affected by how you live, how you breathe, how you manage stress, and how you allow yourself to rest and relax. Attending to these internal factors complements your external skincare practices and often produces results that products alone cannot achieve. Take a deep, nourishing breath right now. Feel it filling your body with oxygen, activating your relaxation response, supporting your skin's health from within. This breath and every conscious breath you take is a gift to your skin and your entire being. May you breathe deeply and often. May you find moments of true relaxation in your days. May your skin reflect the peace and care you cultivate within. Thank you for this time together. Breathe well and be at peace.
To minimize infection risk. Professional dermatology care coordinated with immunology or HIV specialists optimizes acne management in immunocompromised individuals. This coordination ensures acne treatment doesn't interfere with immunosuppressive therapy. Guide 63: Acne in patients with liver disease and metabolic disorders. Liver disease and metabolic disorders can affect acne through various mechanisms. Managing acne in these populations requires special consideration. Liver disease affects hormone metabolism, potentially worsening hormonal acne. Patients with cirrhosis or chronic hepatitis often have worsened acne due to impaired estrogen metabolism and altered hormone regulation. Metabolic syndrome, combination of obesity, insulin resistance, hypertension, and dyslipidemia, correlates with worse acne. The insulin resistance driving metabolic syndrome increases androgens and sebum production, worsening acne. Managing metabolic syndrome through weight loss, exercise, and dietary changes often improves acne. PCOS involves insulin resistance and is therefore associated with metabolic syndrome and worse acne. Managing PCOS-related acne involves addressing insulin resistance through diet, exercise, and potentially medications like metformin. Diabetes, particularly poorly controlled diabetes, worsens acne through multiple mechanisms: inflammation, immune dysfunction, altered wound healing. Optimizing diabetes control improves acne. Liver metabolizing medications used for acne, like spironolactone, oral antibiotics, require dose adjustment in liver disease and monitoring for side effects. Patients with liver disease should have liver-specific dosing guidance from their healthcare providers. Hepatotoxic medications, like isotretinoin, which requires liver monitoring even in healthy individuals, should be used cautiously or avoided in patients with liver disease. Baseline liver function testing and monitoring are essential if used. Weight loss, if overweight, provides multiple benefits including acne improvement through metabolic and hormonal mechanisms. Lifestyle interventions addressing metabolic health support both acne management and overall health. Guide 64: Acne in patients with polycystic ovary syndrome, PCOS, comprehensive management. PCOS is a common hormonal disorder strongly associated with acne. Understanding PCOS-specific acne management optimizes outcomes for affected individuals. PCOS involves androgen excess, ovulatory dysfunction, and typically insulin resistance. These factors combine to cause often severe acne, frequently concentrated on the lower face and jawline. Hormonal testing for PCOS includes elevated androgens, elevated LH with normal or low FSH, and often elevated fasting insulin and insulin resistance markers. Pelvic ultrasound might show polycystic appearing ovaries. Acne in PCOS often differs from typical hormonal acne in severity and resistance to standard treatments. Many PCOS patients with acne require systemic hormonal treatment for adequate control. Birth control pills are first-line hormonal treatment for PCOS acne, with formulations containing low androgenic progestins preferred. Typical acne improvement occurs within 3 to 6 months. Spironolactone provides additional androgen reduction when combined with hormonal contraceptives. The combination often provides better acne control than either alone. Metformin, while primarily treating insulin resistance, can modestly improve acne by improving metabolic parameters and potentially reducing androgens. Typical dosing is 1,000 to 2,000 milligrams daily. Lifestyle interventions are particularly important in PCOS. Weight loss, even if overweight, or weight management if normal weight, improves insulin sensitivity and androgen levels, often improving acne significantly. Exercise, particularly resistance training, improves insulin sensitivity. Dietary modifications emphasizing low glycemic foods support metabolic health. Comprehensive PCOS acne management combines hormonal contraceptives, spironolactone if needed, metformin if insulin resistant, lifestyle optimization, topical acne treatments, and potentially professional treatments. This multifaceted approach addresses both the underlying PCOS pathophysiology and surface acne manifestations. Many women with PCOS achieve significant acne improvement through this comprehensive approach even if acne was previously treatment-resistant. The key is addressing underlying PCOS rather than only treating surface acne. Guide 65, Acne in Patients with Psychiatric Conditions, Medication Interactions and Mental Health Considerations. Psychiatric medications sometimes worsen acne or interact with acne treatments. Additionally, acne's psychological burden is heightened in individuals with pre-existing psychiatric conditions. Managing acne in this population requires coordinated psychiatric and dermatological care. Lithium, used for bipolar disorder, causes acne in many patients. This presents a dilemma: necessary psychiatric medication worsens acne. Options include discussing alternative mood stabilizers with your psychiatrist if possible, combining lithium with aggressive acne treatment, or managing the acne psychiatric medication trade-off consciously. Antipsychotic medications sometimes worsen acne through various mechanisms, though the effect is variable and many antipsychotics don't significantly affect acne. Discussing medication side effects with your psychiatrist helps identify if acne worsening is medication-related. SSRIs, antidepressants, generally don't worsen acne and might indirectly improve it by reducing stress. However, individual variation exists. Stimulant medications for ADHD don't typically worsen acne directly, though sleep disruption from stimulants might worsen acne indirectly through stress and sleep deprivation effects. Mental health in acne is particularly important for individuals with pre-existing depression or anxiety. Acne's psychological burden can exacerbate pre-existing psychiatric conditions. Recognizing this and providing both dermatological and psychiatric support is important. Medication compliance for acne treatment might be compromised in individuals with depression or ADHD. Depression reduces motivation, and ADHD can cause forgetfulness. Building medication adherence support, reminders, routine integration, accountability, helps overcome these barriers. Discussing psychiatric medications and acne concerns with your psychiatric provider helps identify which medications, if any, might worsen acne. Sometimes alternative medications without acne side effects exist. Coordinated care between dermatology and psychiatry optimizes outcomes. Each provider should be aware of the other's concerns and treatments. Guide 66, Acne Treatment and Pregnancy, Safe Options and Contraindications. Pregnancy significantly constrains acne treatment options due to risks of medications to the fetus. Understanding safe treatments during pregnancy allows continued acne management while protecting fetal health. Absolutely contraindicated during pregnancy: isotretinoin, severe teratogen causing birth defects, tretinoin and other prescription retinoids, significant teratogenic risk, oral antibiotics like doxycycline, risks to fetus and teeth, spironolactone, potential effects on male fetus development. Benzoyl peroxide is traditionally avoided, though new evidence suggests safety. Potentially safe during pregnancy: topical salicylic acid used in small amounts and limited areas, large-scale systemic absorption possible though typically minimal, topical azelaic acid, generally considered safe, topical clindamycin, some. Routine predictability helps sensory-sensitive individuals. Consistent routines in consistent order reduce sensory overwhelm compared to variable routines. Minimal product routines: fewer products means fewer sensory inputs, might be better tolerated than complex multi-step routines. A simple cleanse, treat, moisturize routine might work better than elaborate routines. Fragrance sensitivity affects many products. Fragrance-free or lightly scented products work better for fragrance-sensitive individuals. Sensory-friendly product recommendations: lightweight serums, fragrance-free formulations, smooth-absorbing products, minimal texture variations, consistent temperatures, and routines. Professional guidance from dermatologists familiar with sensory sensitivities helps develop manageable treatment plans. Guide 90, Acne and Chronic Illness, Managing Acne while Managing Other Conditions. People managing chronic illnesses, diabetes, autoimmune diseases, chronic fatigue, etc., face additional challenges managing acne alongside.
Welcome to this soothing moment. Breathe calmly and feel peace. Today we're discussing how to reduce redness and swelling naturally, those uncomfortable, visible signs of inflammation that make skin feel and look irritated. Redness and swelling in your skin indicate inflammation, your body's response to perceived threats or damage. While some inflammation is part of healing, excessive or chronic inflammation creates discomfort and can damage skin over time. Let's explore natural, gentle ways to calm this inflammation. Understanding what causes redness and swelling helps you address it effectively. Inflammation can result from active acne or breakouts, irritation from harsh products or treatments, allergic reactions to ingredients, environmental stress like sun, wind, or extreme temperatures, compromised skin barrier, underlying conditions like rosacea or eczema, and stress, which triggers inflammatory responses throughout your body. The natural approach to reducing inflammation combines topical soothing treatments lifestyle modifications, and patience for your body's healing processes. Cool temperature is one of the most immediate, natural anti-inflammatory tools. Cold constricts blood vessels, reducing blood flow to inflamed areas, which decreases redness and swelling. It also numbs discomfort and provides immediate relief. Apply cold compresses for 5 to 10 minutes several times daily. Wrap ice or a cold pack in a soft cloth. Never apply ice directly to skin. Hold gently against red, swollen areas. The cold brings quick, temporary relief and reduces inflammation over time with consistent use. Keep aloe vera gel in your refrigerator. Cold aloe applied to inflamed skin provides both the anti-inflammatory benefits of aloe and the soothing effect of coolness. Green tea is powerfully anti-inflammatory. Brew green tea. Let it cool completely, then soak a soft cloth in it. Apply the cloth as a compress to inflamed areas for 10 minutes. The polyphenols in green tea reduce inflammation naturally. You can also use cooled green tea bags directly on inflamed spots. Place them on closed eyes for puffiness or on facial inflammation for relief. Chamomile has natural anti-inflammatory and calming properties. Brew chamomile tea, cool it completely, and use as a compress just like green tea. Chamomile is especially gentle and suitable for sensitive skin. Oatmeal is soothing and anti-inflammatory. Mix colloidal oatmeal with cool water to form a paste. Apply to inflamed areas for 15 to 20 minutes, then rinse gently. This is particularly effective for widespread redness or irritation. Aloe vera gel, as mentioned, is naturally anti-inflammatory and soothing. Apply pure aloe gel to red, swollen areas 2 to 3 times daily. The cooling, moisturizing effect calms inflammation while supporting healing. Cucumber has mild anti-inflammatory properties and cooling effects. Chill cucumber slices in the refrigerator, then place on inflamed areas for 10 to 15 minutes. This is refreshing and gently soothing, though less potent than other methods. Honey, particularly raw honey, has anti-inflammatory and antibacterial properties. Apply a thin layer of honey to inflamed areas as a mask for 15-20 minutes. Then rinse with cool water. Manuka honey is especially beneficial, but regular raw honey works too. Turmeric is powerfully anti-inflammatory due to its curcumin content. Mix a small amount of turmeric powder with yogurt or honey to form a paste. Apply to inflamed areas for 10 to 15 minutes, then rinse. Be aware turmeric temporarily stains skin yellow. This fades quickly. Beyond topical treatments, internal approaches support inflammation reduction. Omega-3 fatty acids found in fatty fish, walnuts, flax seeds, and fish oil supplements are potently anti-inflammatory. Regular consumption helps reduce systemic inflammation, including in your skin. Antioxidant-rich foods fight inflammation from within. Eat plenty of berries, leafy greens, colorful vegetables, green tea, and other antioxidant sources. These compounds neutralize inflammatory molecules throughout your body. Stay well hydrated. Water supports all bodily functions, including inflammatory responses and healing. Drink water consistently throughout the day. Reduce inflammatory foods. Sugar, excessive alcohol, and highly processed foods can increase inflammation. You don't need perfection, but generally choosing whole, unprocessed foods supports reduced inflammation. Stress management is crucial because stress hormones trigger and worsen inflammation throughout your body, including your skin. Practice daily stress reduction, meditation, deep breathing, gentle exercise, time in nature, creative activities, or whatever genuinely calms you. Sleep adequately. During sleep, your body performs essential anti-inflammatory processes. Chronic sleep deprivation increases inflammatory markers throughout your body. Prioritize 7 to 9 hours nightly. Gentle exercise reduces inflammation through multiple mechanisms, reducing stress, improving circulation, supporting immune function. However, very intense exercise can temporarily increase inflammation. So moderate, regular activity is ideal during flare-ups. Avoid triggers that worsen your specific inflammation. If hot showers increase redness, use lukewarm water. If certain foods trigger redness, avoid them. If stress causes flare-ups, intensify stress management during stressful periods. Protect inflamed skin from sun exposure. UV radiation worsens inflammation dramatically. Use gentle mineral sunscreen or physical sun protection like hats. Simplify your skincare during inflammatory flares. Use only the gentlest products, fragrance-free, minimal ingredients. Avoid all actives and potential irritants until inflammation calms. Use skincare ingredients known for calming inflammation. Niacinamide reduces inflammation and supports barrier function. Centella asiatica is traditionally used for calming inflamed skin. Green tea extract applied topically mirrors the benefits of green tea compresses, and licorice root extract has natural anti-inflammatory properties. Be patient. Inflammation doesn't disappear overnight. Natural methods work gently over days to weeks. Consistency matters more than intensity. However, know when natural methods aren't sufficient. If inflammation is severe, spreading, or accompanied by pain, fever, or other concerning symptoms, see a healthcare provider. If redness and swelling are chronic despite gentle care, you may have an underlying condition like rosacea that needs professional diagnosis and treatment. Prescription anti-inflammatory treatments, topical steroids, azelaic acid, metronidazole for rosacea may be necessary for some people. Natural methods can complement medical treatment but shouldn't replace it when needed. For chronic inflammation, work with a dermatologist to identify the root cause rather than just managing symptoms. As we close, remember, reducing inflammation naturally requires multiple approaches: topical soothing treatments, anti-inflammatory lifestyle practices, stress management, and patience. Your body knows how to resolve inflammation when supported properly. May your redness fade gently. May swelling resolve completely. May your skin return to calm comfort.